Hello, thank you for coming in for an acupuncture appointment today. Can you tell me a little bit about what's going on?
I have migraines periodically. So in addition to the headaches, I have light sensitivity. I do have nausea also.
During an acupuncture appointment, at your initial visit, we walk you through 10 different questions. These are essential questions that we ask, such as questions about digestion, which might seem kind of funny. Why are we asking about digestion when it comes to migraines? But in the acupuncture world, your whole body is connected. So even though it's your head, we're still going to want to know about how your digestion is functioning. We'll ask about your ears, nose, and throat. We're going to ask about the musculoskeletal system. We're going to ask basically about every part of your body, even your menstrual cycles. Now, obviously, only if you're a woman. And we're going to walk you through all of those questions.
Okay.
Then the next thing I'm going to do is, can you please stick your tongue out at me? So I'm going to take a look at the tongue. The tongue is kind of the acupuncturist roadmap of how the body is functioning. So when I'm
Do it again.
Yep. So I'm going to zoom this guy in here. And now when I'm looking at the tongue, poor Lisa, you're such a good sport. When I look at the tongue, it is showing me, you can basically the color, the texture, the shape, all of that is going to help me determine a differential diagnosis in the acupuncture world. It's going to help me determine things like liver qi stagnation, spleen qi deficiency, blood deficiency. I'm also then going to take your pulse. Now, I'm not just getting your heart rate. I am feeling in 6 different positions on each side of your wrists. And that is going to be letting me know how the meridians are functioning in your body. So the combination of all of this, and possibly depending on if you were having low back pain, would be telling me I might do musculoskeletal exams. The combination of all this, and I would actually do your pulse more like you said. The tongue, pulse, 10 questions, musculoskeletal exams if needed, and a few other basic aspects of information allows a licensed acupuncturist, such as myself, to gather a differential diagnosis. And sometimes there's multiple differential diagnoses in the world of acupuncture.
What is a differential diagnosis?
In the world of acupuncture, an acupuncture differential diagnosis allows us to treat without needing a conventional Western medicine diagnosis. So for example, you could have come in without the diagnosis of migraines and said that you have pain in your right eye or like behind your right eye. You might say you get stomach aches or, kind of a bunch of different non-synced up symptoms. I don't need you to have a diagnosis from an MD for me to be able to treat you. Okay. I would then take those 10 questions that gathers all these different possibly non-synced up symptoms, look at your tongue, feel your pulse, and then that's kind of like this really cool puzzle that I get to put together, which is why I love what I do. And then I put it underneath these differential diagnoses. So for you, a lot of times your diagnosis, if you don't mind me sharing,
okay,
might fall under liver qi stagnation with blood deficiency, or spleen qi deficiency and blood deficiency. And so I'm able to use those differential diagnoses to choose the points to use and the herbs to use. Okay. And speaking of which, let's throw some needles in you. Okay. Now we are going to do acupuncture on our patient, Lisa, and she is receiving acupuncture for migraine. We're only going to do a few points, and we're going to clip in Sobhana, who is the other amazing acupuncturist here at Holistic Healthcare Centers. And actually, we also have Dr. John and Dr. Jay, who are chiropractors who do acupuncture for pain management. So you have your plethora of providers who can perform acupuncture for you. But in terms of licensed acupuncturists for treating kind of that internal differential diagnosis, that would be myself and Sobhana. So we're going to do some acupuncture on Lisa's hands for this video. And you're also going to see some clips of Sobhana performing acupuncture on Lisa as well. And this is what it would be like if you were to come here for an acupuncture appointment. All right. So Lisa, how does that feel?
Feels okay.
While I don't clip electroacupuncture onto hand points, if I were to clip an electroacupuncture on, I would just clip it right here. And I would turn on the electroacupuncture and she would feel a slight vibration and then she would rest quietly. So then she would rest for a half an hour and then I would come in. After a half hour, I would unclip it. And I would begin removing the acupuncture needles. And that is an example of an acupuncture appointment at holistic healthcare centers.